Hello, everyone. Welcome to this seminar series. I think we just start off, and the rest of our colleagues will find us as we move along in the interest of time, and so that we can finish also in good time, respecting that we might have some other commitment at the top of the hour. So this part of the implementation Toolkit Small and Sick Newborn Care Implementation Learning Series that is co-developed and co-designed by NEST 360 and UNICEF. And we're using this seminar series to disseminate some of the resources on the toolkit, but also to share learning and experiences from other settings that we work in. And we would encourage you to share those experiences and learnings and ask questions as we go along. Next slide. So the implementation toolkit is organized by the 7 health system building blocks, including infection prevention and control. This is the 3rd seminar on human resources for health, and Zoe and Mita will help post the links to the toolkit and to keep up to date with any new information and events linked to the toolkit. There's also a link to register to a newsletter that comes monthly and that shares a lot of the resources that are part of that. And as I mentioned, this is part of just encouraging collaborative learning to advance what exists out there that we can learn together on newborn care provision. Next slide. So today's seminar on human resources for health will focus on neonatal care workforce education. And the aim is to disseminate some of our resources that are developed by colleagues in NEST 360 as well as COIN on models and materials that exist for national use for clinicians and medical engineers, and opportunities for using these generic materials for national scale up. Next slide. So a lot of our speakers have people who've been involved with the development of the content within the human resources for health, content within the implementation toolkit. So we'll have an introduction, and then Prof. Liz will talk us through an overview on developing education materials for health. And Prof. Elizabeth Molyenux is a professor at Kamuzu University of Health Sciences, but also a co-principal investigator for the NEST 360 program. We'll also hear from on the development of the NEST 360 education materials, focusing on action-focused training with devices, scenarios, and videos. And Dr. Josephine Langton from Kamuzu University of Health Sciences, but also a co-PI for NEST 360 in Malawi, will share materials for clinicians. And then we'll hear from Dr. June Madeti from the School of Engineering at Kenyatta University, and also a technical advisor for NEST 360 in Kenya on materials for biomedical engineers and invention education. Dr. Sue Purridge, who is a board member for Council of International Nurses, Neonatal Nurses for USA and Rwanda, will take us through opportunities that exist within COIN for neonatal education, and then we'll have a Q&A, and please feel free to post any comments or questions as we go along. And then we'll have closing remarks from Professor Joy Lone from the London School of Hygiene and Tropical Medicine, who is also the director for Math Center. Next slide. Next. So just a quick update and background to the human resources for health component within the toolkit. It's organized in 4 broad thematic areas: people and teams, which focuses on the number of staff and the cadres and the skill mix required and the knowledge that they need to deliver small and sick newborn. There's the neonatal workforce and education, which we'll hear a little bit more about today. And then we have enabling environment, focusing on the resources required for provision of newborn care, and then the mental health and well-being of healthcare providers for neonatal care, pretty much looking at how do we care for the carers. I'll now hand over to Professor Liz Molyenux to walk us through the education materials. Welcome, Liz. Thank you.
Thank you, David, and greetings, everyone. And it's my honor really to introduce the topic and also to just give an overview of how we've tried to look at health education. And I'm sure we've got lots to learn from each other. Next. So let's just look at what's available and perhaps what more do we need and how we look at the various pieces of material that we've got and how we put them into context. Next. So health education has many definitions, and obviously we've focused right down. So health education could be self-education, could be, how you look after yourself. But here's one which simply says consciously constructed opportunities for learning intended to facilitate changes in behavior towards a predetermined health goal, which is not the only definition, but I think a useful one. Next. But we have focused down on human support resources to support newborn care and innovations with the intention to reduce mortality. Next. And that's our goal. So who are our target audiences? Well, we've tried to include all the clinicians, doctors, nurses, clinical officers, but we're not focusing only on them. We're very interested to bring biomedical engineers and hospital technicians into this as well. We're all trying to help the same baby. Next. And we may be a student, we may be a service provider, or we may be somebody who's actually teaching the group that we've just described. Next. So our target audience. So we've got this group, and then we've got, next, the ways in which they might use things in service with updating knowledge or skills, installing various pieces of equipment through mentorship, and there may be supportive supervision. So that's largely in service. And next, we've got pre-service, and that's largely through looking at the curriculum, trying to provide skills labs so that they can actually practice what has been taught to them theoretically, and then trying to support the trainers so that they have the ability to really pass on this learning and this education that we're trying to do. Next. But all our material has to be evidence-based. It needs to be adaptable because people need to modify things a little bit to fit their own environment, and therefore flexible. It does need to be very clear, and above all, it does need to be wanted. It's no good producing something that nobody really feels a need for. Next. But education is much more than knowledge. There's been a lot of sort of transfer of knowledge, but it's much more than that. Next. As we said, it must be evidence-based. And very often we've chosen a WHO standard, and we've looked certainly at all the other standards as well that come from the neonatal associations, as well as the pediatric associations. Next. And those include knowledge and practical skills, safety with any equipment that they're using, and obviously teaching, but they should include, next, teamwork, because that's really what we are all about. Very few of us are single-handed looking after a baby. We're usually in a team. We need to be able to communicate well. We need mentorship, and we need feedback. And all of those are all part of education, but we need even more. Next, we need to include leadership, and we've got to be able to organize ourselves. Next. And clearly, these are all linked together. So we've really tried to build a whole education module, materials around this sort of thought. Next. So what are our tools of learning? Well, of course, there are courses. And then we have modules of various sorts, clinical, technical. Courses may include modules. It can be used separately. Job aids, which may be on the wall or attached to a piece of equipment. Videos are really useful, and they have to be very carefully produced so that they really do reflect what needs to be done. Mentoring needs some sort of guidelines and some sort of learning as to how to do it. Same with supervision. Indeed, apprenticeship too, which is very much part of both nursing and medicine. And I think our biomedical engineers are the same. And then we need to learn how to run group discussions and etc. So there's a lot of tools that we have. Next. And then we've got different methods of learning. Lectures, group discussions, skill stations, scenarios, and role modeling. And I think all of these too, we should use and use effectively in different situations. Next. And then we've got teaching the teachers. So we've got the tools, we need to think about the methods, and then who and how are people going to actually teach it. Next. And it needs to be accessible. So face-to-face learning, I think we all really appreciate that, but that is costly, it takes time, and it takes people away from the job they're doing. It's absolutely essential for some types of teaching, but not for all. Books, expensive, difficult to get, not always up to date. E-learning, wonderful, if you've got the internet access. Distance learning, I think we haven't perhaps done enough of that. We need mobile phone apps. We need to think of those in terms of learning tools, and interactive e-learning modules. And then again, videos, which equally can be interactive. Next. But they do need to be context specific. So if you don't have adequate broadband, however wonderful a piece of e-learning you do, it may be difficult for somebody to take part. And particularly if it isn't downloadable somewhere where you haven't got easy and constant and reliable access to internet. We need to think about cost, which is efficiency. Have we got it in the right language? And we really, above all, must follow national policy. Next. So what else should we do? Have we thought about platforms adequately? Have we thought about the content? Have we got the content which can go easily onto a platform? Perhaps we need to be thinking more carefully about a registry for trained personnel so that we're not saying the same thing to people, frequently. Perhaps prioritize what's available, what's wanted, what's necessary, and then how to access tools for face-to-face skills learning. Because we can't teach about equipment if people can't get their hands on it to actually learn how to use it. And then we do need quality control in teaching and learning, as well as in everything else that we do. Next. So just a few pictures of various bits of education material being used in different ways. I think you can just flick through these for me, Mita. Keep going. It's lots of different manners in which it's using. Here we've got different countries and again, different people using in different groups or lecture halls or skill stations. Next. And here we have some more. So I think there's lots of ways in which we use our learning material. And I think there's many more ways in which we could take advantage so that we can make the best of what we have and how we use it. Thank you. So I'm going to pass on now to Dr. Jo Langton, who will be talking about the clinical materials that NEST have been developing.
Good afternoon to everybody. Next slide, please. So as Prof has said, my name is Josephine Langton. I am a pediatric emergency medicine consultant out in Malawi and also have an interest in medical education. I am going to talk through the process which we use to develop the educational materials for NEST 360 and also highlight some of the materials that are available. Next slide, please. So the process which we took to develop the educational materials for NEST 360, as you can see on the screen, it was quite an extensive process, and this was used for both the clinical and the technical educational material which was developed. And I am not going to steal my my subsequent presenters' thunder, so I'm just going to talk about the clinical stuff mainly. But when we started, we did an extensive needs assessment, and one of the most important things was that we involved all of our key stakeholders right from the beginning. So anybody who was involved in pre-service or in-service training were involved in the process, and all of the curricula were reviewed to identify the gaps which needed to be filled in terms of educational material. Having done that process, we then went on to develop 8 draft modules, and this was for both clinical and technical material. And specifically, the gap which was identified was the use of technology to augment neonatal care. So most countries had content available for clinical care, but not how to use technology to augment that care. Once these had been drafted, we then came together as the 4 countries and reviewed the material in great detail, and resulted in material which had consensus opinion, and we integrated all of the comments which came from the countries and ended up with an almost final draft of the modules. And they then went out for internal review. And so from a validity point of view, we made sure that we wanted the materials to be valid, and we wanted people to be confident in terms of the content which was within this material. So there was an extensive internal review which was done, and again, the material was modified based on the feedback from that internal review. It then it was very important that we recognise the evidence base for this material. So although people have their opinions from a clinical point of view, we needed to ensure that everything was evidence-based, and that evidence base was taken from reputable sources such as the WHO to support what we were doing and what we were advocating. And then finally, the material went out for extensive external review, and it basically, as you can see on the slide, it was the great and the good that it was sent out to, and the feedback from the external reviewers was then incorporated into the material before the 8 modules which had initially been drafted were then finalised. Next slide, please. So this material is now available on our NEST 360 homepage. They are available to download, and they are being accessed across the world, not just within the 4 countries where NEST is currently based. Next slide, please. So I'm just going to walk you through some of the materials which are available, and also touch on how these are being used within the educational settings. So there are clinical modules which have been developed. Currently, there are 8 available online, and the devices which these are for are listed on the screen. The important thing to raise about this material is that it isn't focused on clinical care. As I've said, most countries actually have material about how to care for newborns. This is about how technology can be used to augment that clinical care and improve the care which is being given, and thereby improve outcomes of the newborns. So this material, the modules are essentially generic. They're not device specific, because we recognize that across the world, there are many different types of devices available. So the modules have been written specifically to be generic so that they can be accessible to many, many people. And the purpose of the material is it's essentially meant to be very flexible so that people can use it as they want to. And what people have done with the clinical modules is essentially they have incorporated it within their national training programs or within their curricula for the pre-service training, so within the educational institutions. So this material has been integrated into both pre-service and in-service trainings within the 4 countries in NEST, and the stakeholders, having been involved right from the beginning, have welcomed that. Next slide, please. So whilst there are 8 available online at this time, we are still continuing to work in terms of developing educational content. And at this point in time, we are in the process of finalizing several new modules. So the point of care module is almost ready for dissemination, and that now includes new devices such as the hemoglobinometer and the BILI-DX, which is a NES-specific device. And also we are working on the syringe pump module as well, and there will be more devices coming after that. Next slide, please. So clinical modules are all well and good in terms of content within a course or within a training or within a curriculum, but actually, as Prof highlighted, we need a variety of different tools, educational tools to use in different settings. So in line with the modules, other material has been developed, and these include job aids. And job aids are essentially quick reference aids which people can use both within teaching and within the clinical setting. And these are device specific. So unlike the modules which are generic, these are very much device specific, and it helps people in terms of guidance of how to use the equipment. And it has, as you can see from the image on the screen, there are images and there's very little words. So they are quick reference, they are easy to use, and people can use them in the clinical setting very, very easily. And that is certainly what is happening within the countries. However, they are also useful from an education point of view, both within pre and in-service training. We have used these within Malawi in training our medical students on the equipment, and we've used them in a process called speed dating, where they rotate through the equipment and they have a brief period of time with the equipment, and we make reference to the CPAP, to the job aids as we do it. They've also been used within our training of trainers courses, because they're very easy to make quick reference to. They can be used for demonstrations. They can also be used within the clinical courses, and so the neonatal courses, so that people can ensure that they are doing the right thing. Next slide, please. And in addition, we have also produced some videos. So I'm just going to let the video play for a minute. So the videos are essentially, again, to augment the training, and they are designed so you can dip in and out of them. You can use certain aspects of it. This one is just you can see it's a variety of images which are being used. So it's not actually the educational video, but this shows the quality of the videos which are available. And essentially these videos cover how to set up a device, how you use a device, but also it emphasizes the importance of the integration of the technical aspects. So the preventative maintenance and the cleaning, the troubleshooting and the repair. And it's very much about us working hand in hand with our engineering colleagues and our technical colleagues, so that we can work together to reduce neonatal mortality. Next slide, please. Obviously, there are times when we want to deliver training which needs lectures or interactive sessions. And so there have been slide sets which have been developed, and these have been used within the neonatal courses within the countries. And also they have been used within the generic instructors courses, which I'll come on to shortly, so that our candidates can practice delivering teaching. Next slide, please. And then finally, we have also developed scenarios. And as most of you will know, scenarios are simulation-based teaching. And we have created scenarios which integrate the equipment within them so that people actually understand how to teach using the equipment. And these have been used within neonatal courses, they've been used for mentoring, and they've been used within our generic instructors courses and our training of trainers. Next slide, please. So as I mentioned, we have also recognized the importance of training people to teach properly. Education is really important, and it is very important that we are teaching people how to teach so that we can ensure that the teaching is of the highest possible quality. So we have developed a generic instructors course, which is specific for the training through NEST. And we have sessions which essentially, we have plenary, we have sessions where people practice, we have demonstrations, and it is in line with generic instructors courses across the world. It's just that the scenarios which we use are very specific to NEST. Next slide, please. And within this, we teach people, essentially, as I've said, we're teaching people how to teach, and we make sure that they leave suitably qualified to deliver the teaching within the countries. And it is certainly making a difference, and it has been recognised to be something which is very beneficial within the countries. Next slide, please. And the thing which is particularly unique about our generic instructors course is that it is bringing clinicians and engineers and technicians together, and nurses together, so clinical staff and technical staff together, to learn together and to work hand in hand within this course, to teach together, to learn from one another. And that is one of the biggest beauties of what NEST has done, is it has brought the team together from a clinical point of view and from an engineering point of view. And it has recognised the importance of bringing our engineers into the setting and the clinical setting. They were there, but I don't think they were recognised in the way that they should have been, and NEST has managed to successfully do that. Next slide, please. And as I've said, one of the things which has really been recognised as beneficial is our GIC. And this is a quote from one of the courses which was held in Nigeria. And it's really inspired people to actually teach to a high level and in different ways. So this is something which we're really proud of. Next slide, please. In addition to the technology-based teaching, obviously over the past couple of years, none of us can escape the fact that COVID has been around, and we recognise the importance of developing educational material specific for COVID and looking at neonatal units. And so material has been developed for that. And throughout all of the material which has been developed, there is a specific emphasis on infection prevention, which is obviously exceedingly important within our neonatal units. And we all know the issues that there are with infections within neonatal units, so there is particular attention focused upon that. Next slide, please. And obviously this has been a journey for everybody within the educational process. And so one of the things which was recognised is that we can all learn from one another. And so each of the countries involved within NEST have essentially documented their journey, and their journey through incorporating materials within their trainings and how they use their trainings and who they're training. And this is a really useful tool to help people learn about how to manage establishing educational programs, how you can learn from one another, and basically ultimately aim for best practice. So this is something which is very interesting to read, particularly if you're at the start of the journey of actioning something similar to what we have been doing. So that is the materials which are available from a clinical point of view. And I am now going to pass over to June, who will talk through the technical side of it.
Thank you, Jo. Thank you, Prof, for your initial introduction to the materials. Biomedical engineering modules are also found in the same link as the clinical, and they were developed to support engineers to implement this evidence-based model. And we are very, the training using the modules has been very emphasis on the practical aspect of maintaining and safely repairing equipment essential to newborn. Next. So these are the slides, and these are the modules as for the technical ones. They're found in the same page as the same site as the clinical, and the link can be seen there. Next slide. So Joe has mentioned about adoption of the materials and the modules that are present in the website. And I'm going to go through how the Kenyan experience is. The technical modules were customized into a skills lab manual, and this is used mainly for the pre-service labs. The skills lab manual follows the curriculum way of drafting, including learning outcomes for each level. And we have different outcomes from first years, different outcomes for fifth years, and they all use the skills lab for the training. The manual is planned to be commissioned by our Association of Medical Engineers in Kenya, and this is to be done in December 2020 after all the edits have been completed. GIC training, as Joe has mentioned, is very unique, where it combines both technical and clinical and both pre-service and in-service. And we found this to be very interesting as they learn together in the same space. Face-to-face training is very important for technical aspects of it, and where it is customized for in-service, which is and for pre-service engineers. And this is normally done over a course of 5 days, but I'll go into that more in the next slide. But we used to do it for 3 days, and after different learnings, different feedback from the participants, and actually going to mentor and assess the in-service and pre-service engineers where they work, we found that face-to-face training needs to be longer. We've also run a series of webinars where we have conducted for all the equipment, and during the webinar, some of the instructions are also done using videos. And for the next slide, we can see an example. Next slide, please. Where we have a Flowmeter video example, and you can see that it goes step by step and talking about how the repair is done, how you replace the Flowmeter, tools you need, and the spare parts you may need during the work. Next slide. So as I said, we are using the modules and we've adopted them. So we can have in-service training in the country. We've carried out the training in 13 facilities. We have trained a minimum of 3 engineers in each facility. Some facilities we did more if they have more technicians to provide for us. For the pre-service training, we've established 8 skills lab within the country, 6 in technical colleges. And this is where they train certificate, diploma level. And we have 2 universities where they train degree. And 3 faculty has also been trained for the learning institution. So we have a very big pool of engineers who've been trained. Curriculum adoption for the technical colleges, it's taken longer because they have to be done on all the campuses, and we haven't installed skills lab in all the campuses, so this one will wait. But for Kenyatta University, because it's just for the school, the curriculum has been reviewed to include the NEST bundle. So and it's been done for 3rd years, 4th years, and 5th year undergraduate students, and this will be implemented in the next from September 2022. The skills lab are used for diploma students and degree, as I said, and the NEST modules are very key as a guide. We call them like a textbook, and they've been referred in many areas. Next slide, please. So face-to-face training, as I mentioned earlier, the training model was 3 days, and day 1 was technology management, which we found a gap in, and day 2 and 3 was hands-on training. But as feedback, we changed to 5-day training, and this has happened. We've done 2 of the 5-day trainings where we do practical assessment on each device, and we found that after this, once we go to the facility to either do mentorship or PPM, they are normally more versed with the technology, and this is the best approach we found to to make sure that learning has occurred, especially for the technicians in service, because as you know, once they're in the hospital, they never get to open these machines until they're broken. So with this practical element in the training, they get to practice. And then we've combined both in-service and pre-service in the training, so they get to know each other and network. So if one of the in-service engineers something they need to learn to practice more, they can visit the skills lab near them and be able to practice as well, instead of using the machine that is already in the patient. And for this, they use the skills lab manual, and they can be able to be guided by the faculty. Next slide, please. Thank you very much, and I'm looking forward to questions. I've gone through a case for Kenya, and I'd like to introduce the next speaker, Dr. Sue, who's going to talk about COIN's neonatal education, and I'll be around for any question. Thank you very much.
Thank you. Good morning. My name is Sue Prulidge. I'm a neonatal nurse practitioner, the secretary of COIN, and I also am the facilitator of the educational programs that we're going to talk about today. Next slide. COIN is the Council of International Neonatal Nurses, and we're holding a couple of different we're doing an orientation program and a post-diploma program, which we're going to talk about. Next slide. COIN has been incorporated since 2005. We represent over 60 countries. We have 17 national organizations across the world, all the way from Australia to Zambia. And we hope to be the voice of neonatal nursing globally. Next slide, please. As you can see here, we have been working in Africa, doing different things. We've done the small and sick newborn competencies and curriculum development for we've helped the WHO. We've worked in Ghana. We've worked with the Nigerian doctor group, University of Malawi, University of Sierra Leone, and University of Rwanda. We've been teaching courses. And I'll talk about this in a bit. We hope to teach an MSN course in Nigeria. We've done some teaching in Rwanda and Zambia. Faculty mentorship is important because as we've started talking about all of the sick and newborns, we have talked with faculty that feel like they need resources and would like to have people that they can walk alongside them as they teach. So we hope that we will be able to mentor in Ghana and Nigeria. We have already done this in Malawi. With Project Hope, if anybody's interested, we can talk about that later. Did it in Rwanda and will be doing it in Zambia. In-service training is for nurses that are already working. Hope to do our orientation process in Ghana. We are currently holding the orientation process with students from Rwanda, Zambia, and have done the pre-service or in-service orientation in Burundi. Next slide, please. So we also have done quite a bit of consultancy work. We worked with Save the Children, USAID, with the Ghana College of Nurses and Midwifery. They asked us to look at their first year neonatal nursing curriculum. And then eventually we did look at their all the way up to their third year. And we just made some suggestions on how to make it more neonatal oriented and how to just get the neonate into those programs. NISAM is the Society of Medicine in Nigeria. They have asked us to develop an MSN neonatal program, which has been developed and is currently going through some process in Nigeria, and hopefully we'll work with a couple of different universities there. And they have asked us to help teach that program. So as soon as that's approved, then we will be helping them teach the MSN program. ESACON is the East Central South African College of Nursing. They have asked us to look at their neonatal fellowship or help them develop a neonatal fellowship program. Spent a lot of time thinking and talking about this and felt like it needed to be a postmaster's neonatal nurse certification. As things are changing on the African continent for neonatal education, there's several MSN programs that are being developed and going forth. And certification would be very important to have, especially if you're going to ask these nurses to work as advanced practice nurses. And we felt like the minimum degree for that should be the master's. Next slide, please. So now I'm going to talk about the two specific programs that are going on at this point. And the online PDIP is the postgraduate diploma program, which we are holding in Nigeria on Moodle. Moodle is the learning platform that we're using. It's an online learning platform. It's a 9-month didactic given in three different blocks. And the first block is the building blocks. So they get embryology, genetics, anatomy and physiology. They get an intro to the small and sick. They get an intro to neonatal nursing, pharmacology, and the basic resuscitation. They are currently in this process right now. They're finishing up within the next couple of weeks. Then they'll take a small break, and then they'll move into block 2, which is heavier in neonatology education. It's the management of infection, high risk 1 and 2, which is all about management, care of the neonate in the neonatal unit and beyond, which is neurodevelopmental neonatal care, and discharge and follow-up. As most of the nurses that will be going through a post-diploma program or MSN program, they're considered the experts in the field. So we added quality improvement, research, leadership, and teaching strategies because they're going to go on to mentor and advanced resuscitation. Then their third block, they move into a 13-week mentored fellowship. And this is an ongoing discussion. As Elizabeth has said, it's not just a transfer of knowledge, that we need to take it further than that. How this mentorship will go down is still not determined. And I'm going to talk about this in the next couple of slides. So we don't know how it's going to happen in Nigeria yet, but we do have some mentorship going on with the 12-week program. Next slide, please. So they come to Zoom twice a week on Tuesdays and Thursdays for 2 hours. They have a live Zoom, they come to Moodle, I'm sorry, have a live Zoom classroom interaction where the instructor there, and these are all international neonatal nurses that have applied, and we've looked through their CVs, and they know to teach evidence-based, and many of them have African experience. Many of them are from Africa. So they are teaching live on Zoom through the Moodle platform. Then for the next week, they have weekly case studies, discussions, or even a quiz to finish up. Currently, there are 64 Nigerian students, all from 6 different facilities. Next slide, please. And then we have our 12-week orientation program that's being held for the Zambian, Rwandan, and I think we have one Ethiopian student. They learn about neonatal nursing, pregnancy and labor, central care of the newborn and how to feed the well baby, failure to breathe and organization of the neonatal unit, intro to the small and sick, how to feed and do IV fluids for the small and sick, pharmacology, management of infection, neurologic and advanced resuscitation, genetics and surgery, cardiac and ENT. They learn about neurodevelopmental, how to provide that in their units. They learn about testing and discharge, ethics, professionalism, QI and research, leadership and teaching. They are currently in this process and they're almost done with their 12 weeks. Next slide, please. So what this too is online via Moodle live Zoom. They meet every Wednesday for 2 hours. They do case studies, discussion, and quizzes also. There are 11 Zambian nurses, 36 Rwandan nurses, and 1 Ethiopian nurse going through this program. Next slide. Now, mentorship. This has been an ongoing discussion because we all know that transfer of knowledge is just what it is, but how do we help them implement this knowledge once they receive it in their neonatal unit? We can't all go. It would be nice if we could all go and mentor and walk through this with them for weeks upon weeks, but it's not necessarily feasible for the countries to pay for us to do that. And most of all of our nurses are working. They're working in busy level 3, 4 units, level 2 units. So we're we're in the process of getting ready to start this process of online mentoring. So what we will do is we will match neonatal nurses, and we have a call out for them now. And we've got a lot of nurses that are willing to mentor, and they will be matched with either one international neonatal nurse with one or two, depending on how many mentors we have, Rwandan or Zambian nurses. So they'll have these nurses as their mentor through the process of the several weeks after they get done with this program. They will work via WhatsApp or Zoom, depending on what they are asking for. And the goal is for them to be available to answer clinical or other questions related to neonatal care and to provide resources to help the mentee teach and mentor others. They also can discuss skills and provide online examples if possible. And all I can say is mentorship has not started in Nigeria as of yet. And we're trying this. We'll see how this goes. As I said, this has not been done yet. We hope to start this in the next couple of weeks. Next slide, please. All of our program, all of our skills, all of our mentoring is based on our competency framework. And COIN has developed neonatal competencies that start with the belief on the Benner's theory that all nurses that enter neonatal units come in with minimal, if not beginner knowledge of neonatal care, and that it takes at least a year, if not longer, to move them to a higher up. They go from beginner to advanced to competent to proficient to expert. So it takes a while to become an expert in the field. And we have this on our competencies and what is expected. We've also taken our competencies and applied it to a skills checklist. It's all available via the Journal of Neonatal Nursing. And on that skills checklist, we move them from beginners to expert. And we also have designated what we would expect each one of these, what you would find in a level 1, level 2, level 3, based on the WHO guidelines. So that's what COIN is doing. And now we're going to open it up for Q&A. We have a few minutes to do so. What do you think, David? About 5 minutes. We can try and get some questions answered. I'm going to open the Q&A box here. Ashok, are these questions or just statements? I think they're mostly statements.
Yeah, I think Prof. Ashok, maybe these are very exciting comments, and maybe you could share some of your experiences from India. And Mita, maybe can you allow Prof. Ashok the mic? Good.
Thank you, Joy, Elizabeth, and the entire team. I think you are doing excellent work. And I am so happy to see the entire framework for education. And the best part is NEST 360 is a holistic program. You are targeting even the biomedical engineers, the technicians, in addition to frontline health worker. And the other thing which is very important is a collaborative learning platform which you have built, because the different countries are sharing their experience and learning from each other. I think that is the way to go for implementation of best practices. And I'm also so happy that the COIN, Sue and her team is actively supporting building nursing leadership in all these countries, because without nursing leaders, it is impossible to provide care for small and sick newborn babies. And for that, I congratulate COIN for taking this initiative. Though you are doing online through the Zoom platform using Moodle platform, which is for e-learning, it would be always better if 1 or 2 nurses can visit the unit once the COVID pandemic is over, because 1 or 2 nurses visiting a unit, interacting with 15, 20 more nurses in that country will bring a sea change in improving practices for newborn nursing, especially by the nurses. So I don't have any questions, but I'm very happy to see that the NEST 360 program, which is Vision of Joy Lawn, and many of you senior people, is unfolding because it relates to implementation. It is not only cognitive and knowledge dissemination, it is experiential learning which has to happen at the places where it is with the families, with the sick newborn babies, with the mothers for KMC. So experiential learning is a model for implementation, which is happening here. And you have rightly inbuilt QI also into the NEST 360 program. So Joy, I don't have any questions, but I'm very happy listening to the entire webinar for the last 1 hour.
Ashok, you're such a guru for many. It's just wonderful to have you here. Thank you.
Thank you.
So there's one question for you about accreditation for people who already skilled in the chat from Joy. And maybe, yes, you respond to that is also other people from other countries besides the countries that COIN is working in, if they would be interested in some of this online platform, learning from some of these online platforms, what would be the process? Are there any costs associated with that? Oh.
So the process in Nigeria was, we had the neonatologists that approach us go to the nursing council and ask them if they, number one, if they would allow this, because many of the countries are taking the recommendation of the WHO to move to the BSN or greater for neonatal nursing. In Nigeria, they said they would not stand in the way of the post-diploma program, but they themselves are not offering that, but they would recognize that the nurses went through this program and their recognition would come from the hospitals, the 6 different hospitals that put them through the process. So, and then these nurses, if they decide to go on to the MSN, which will be a recognized program across the country, will have the ability to do so and will have the extra application process of going through the post-diploma neonatal nursing program. We also will give them a certification that they finished the program via COIN. The 12-week in-service program, we will give them recognition from COIN that they can put into their portfolio. And then always the neonatologists that came to us and asked us to provide this education will also recognize what they've been through and take them the next step forward. The mentors that we're having in Zambia are actually they're 2-year MSN students. So we will be mentoring them with neonatal nurse practitioners because Dr. Kunda really wanted us to teach them how to be an advanced practice nurse. I hope that answered the question. And yes, we would be very happy to host a different, we're hoping to standardize how nursing education is done, at least with our competencies, because we see a lot of different things being taught. As you said, it needs to be evidence-based. So we would be happy to help you, any country that would like us to provide the education.
Thanks. So
yes,
I think there have been a couple of other questions posted in the chat and Q&A. Maybe Joe or Professor, do you want to quickly respond?
I can certainly say something about the two, perhaps. One is about mentorship, and our mentors. NEST has certainly helped with all the training, and they have helped with actually thinking about how mentorship should be done, but it's done very much with the national mentoring, so that because there's a national program now, people are much more aware of the need for mentoring and for the need for sustained training to be able to make quality improve. So it's been very much supported and in some ways affected by NEST, but very much under and in the national system. Language, we would love something to be in French, for instance, for Africa, because really we leave so much out, so much of Africa out when we don't have French. And I think that's the next step, really. We need to think about other languages.
Yep.
Thanks, Prof. Please, Joe, any last remarks before we head over to?
There were two other questions in the chat. One was about use of the materials from a pre-service point of view, whether they're used at undergraduate or postgraduate level. The materials are written in such a way that they can be incorporated into either, and they have been used both at undergraduate and postgraduate level, both within the clinical, so for nurses, for clinicians, for BSc students, so for clinical officer students. So they're written in such a way that it can be used at either level. And then there was another question, I think, about the GIC, I think it was meant to be, which is in terms of who should house it. So this is a high-level educational training program, training course, and it is a high-level course. So it should be housed either by a professional association or by an educational institution, or it could be owned by the Ministry of Education. So it is a high-level training course, and it probably wouldn't be under Ministry of Health because it's educational, but it could be at that level. So I hope that answers that question.
Okay. And then the question about how we can find the experts in neonatal care to mentor the trainees. We put a call out to the COIN itself, and we asked to see each CV, and we looked to see if they were trained, if they have done training of neonatal nurses. Many of them they're unit trainers. Knowing full well they've not been to Africa, but they can answer neonatal questions. And if they cannot get that answer, they can always come to those of us. And I think that's enough for questions at this time. I'd like to have Dr. Joy Lond take us to the closing remarks. And thank you, Dr. Joy.
Well, thank you, Sue. Thank you, David. And thank you, all of you. I think what we hear is such a passion and a depth of understanding of what it will take. So newborns are our world's most vulnerable citizens. We have 140 million born each year, and 30 million of them every year need this care. And we don't have enough workers. As Liz has said, Prof. Liz, we need a team. So thank you, all of you, for being part of that team. 3 words to you. First of all, thanks. Secondly, please join us, join the Toolkit. It's 300 people. We're deliberately brand neutral. You know, we welcome all of you and your experiences, input and add in French too. Thank you to Chiesi for funding the French translation, which is now moving in the background. And the third thing, so the third word is courage. We need courage as we go out and as we lead other people and as we serve and as we make a difference for families and newborns all over the world. So thank you and have a lovely rest of week. And thanks to all involved, fantastic speakers and wonderful background leadership from Zoe and Mita and others. So please do join. If you're not getting the newsletters, either sign up for them or check your spam. And please do join and bring your ideas. If you would like to speak or lead on a webinar, just let us know. And thank you again.
Thank you, Joy.